Hello, my name is Linda Pollard and I'm the Chair of Leeds Teaching Hospitals NHS Trust. I'd like to welcome you to our second virtual annual general meeting. I'm so sorry that I'm not able to be standing in front of you in person, and I'm sure you'll understand the reasons. We are unfortunately unable to hold our AGM as a face-to-face meeting. Just like last year, the ongoing safety measures we have in place to prevent the spread of COVID-19 means that for the second year running, we are unable to hold our AGM as a public meeting. However, we still feel it incredibly important that we continue to hold this event to stay in touch with you, with all of the people in our communities, and with our key stakeholders and partners, by providing information on our progress and achievements, as well as our annual statements of accountability. We will keep our presentations and videos concise, giving you key facts and figures in a way which I hope you will find engaging. You can also view our annual report and accounts on our website for more information. To begin with, I want to speak about the Trust's achievements and overall progress, even faced with the challenges of COVID. Our Chief Executive, Julian Hartley, will then run through the operational highlights and key updates from the last year. And finally, Simon Worthington, our Director of Finance, will present information on our financial progress. These updates will all relate to the activities of the Trust from April 2020 until the end of March 21, and as such will incorporate much information about the Trust's response to the COVID-19 pandemic, which has been an ever-present challenge throughout this 12-month period. I really hope that by the end of today's meeting, you will have a good understanding of how we have managed the pressures that staff in our hospitals has been under throughout this terrible pandemic. We know everyone has felt those pressures in their own lives, as individuals, within their families, and through being at work or through not working. It has been a truly unprecedented experience which has tested us as a nation, as a hospital, and as healthcare professionals, and equally as individuals. I honestly believe that our people have responded in incredible ways to the situation they have faced. So today, I think my job is to share the story of how our staff and services worked during this COVID year. They have been heroes, even though they did not seek this status, nor did they always feel that way. I have personally spent a lot of time during the past year understanding how best to help my colleagues to perform at the highest level to deliver planned care, treat COVID-19 patients, and to maintain services for those in need of urgent and emergency care. I want to start by expressing my sincere and profound thanks to every single member of our staff for their incredible response, resilience, and dedication over the last year, which has arguably been the most challenging that anyone has faced in their career. The pressures under which people across all areas of the Trust operated were very severe indeed. Many people switched to unfamiliar roles, which were often extremely arduous, typically professionally extending and sometimes psychologically fatiguing. Many who were used to seeing their patients recover instead saw patients deteriorating, and sadly, of course, in many cases, very poorly patients did not survive. Of course, there were also many moments of joy when patients who had survived long, serious infections, whose only contact perhaps for months was with healthcare workers behind protective masks and visors, were reunited with their loved ones after many weeks of isolation and invasive treatment. These moments were as powerful as any likely to be felt in people's lifetimes. There is no way to explain the impact these events have had on those who worked tirelessly and at some personal risk to provide care. I want to put on record my very great thanks to everyone for their dedication and commitment. I am sure I speak for everyone here in offering our sincere gratitude. We are now in wave 3 of the pandemic, seeing a new potentially more virulent variant of the virus and treating not only COVID patients, but non-COVID patients who need emergency or acute treatment, or patients on waiting lists whose conditions have deteriorated or need to be seen as a priority. There is an urgent need to reset and stabilise services, even though many staff desperately need some downtime. Our staff are managing multiple pressures without the capacity created during Wave 1 by national decisions to stand down elective procedures. These pressures include high levels of demand created by seasonal illness, as well as carrying out emergency care and surgery for high acuity conditions, including cancer, transplants, and so on, and trying to maintain as much non-urgent, but nevertheless vital care as possible. And with the pandemic still not over, it is by embodying the Trust's Leeds Way values that our colleagues continue to provide the highest standards of care to our patients, their families and carers, and give support to their own families and their colleagues. We have created a video for this AGM which demonstrates just some of the incredible work and achievements of our staff across the Trust because of, in spite of, COVID-19. I have to extend my thanks to the amazing team involved in establishing and running the vaccination programme, not least the many staff members who have been seconded to the vaccination centres, and volunteers without whom this programme would not have been possible. They are helping us to win the race between the vaccine and the virus, saving lives and helping communities get back to something like normal. Operationally, one of the main achievements the Trust has made in the last year is the establishment of the COVID-19 vaccination programme. We are the lead trust in a partnership across West Yorkshire, and it has taken a Herculean effort to implement this vaccination programme in a rapid and efficient manner. A major vaccination hub was set up at Thackeray Medical Museum, which became operational in December, followed by another hub at Elland Road, which opened in January. We have since worked hard to expand the programme, offering walk-in vaccination centres and pop-ups at smaller venues to reach as many people as is possible. The site at Thackeray has since closed, having served its valued purpose, whilst the site at Elland Road continues to operate as our largest vaccination hub for the people of Leeds. Just last month, we marked the incredible milestone of giving 1 million vaccine doses. Elland Road now has a newly created facility from which I will continue to operate at least the rest of 2021, subject to the ongoing needs of the vaccination programme. Whilst the pandemic continues to place restrictions on many aspects of our life and how we conduct business, it has also presented opportunities to develop new ways of working and pushed the NHS to embrace advances in digital technology to enable us to continue to deliver our services. By March 2021, 55% of outpatient activity was being delivered virtually, meaning we were able to continue caring for more patients who otherwise may see their appointments postponed and treatment delayed. In another example of innovation, we were able to introduce a new system whereby patients with skin lesions were able to submit photos of their own diagnosis and, where appropriate, had surgery scheduled within days rather than face delays. This is the direction of travel now, in which digital technology has been able to improve patient experience and ultimately the outcome by enabling patients be reviewed and treated sooner. Beyond embracing new technologies, we are proud to be at the forefront of numerous pioneering research trials, studies and observations. We supported the setup and delivery of a broad portfolio of COVID-19 research studies, recruiting more than 30,000 patients to over 40 research programs. We also recruited more than 15,000 people to 232 trials in other areas of research, including cancer, maternity, cardiology. We are privileged to continue to the advancement of medical understanding, diagnosis and treatment by supporting research in these ways. It's exactly these kinds of exciting research and innovation that are a key element of our work and our strategy going forward. At last year's AGM, I updated on the hugely exciting plans for Building the Leeds Way, our project to develop a new hospital for adults and a new home for the Children's Hospital, alongside a new pathology laboratory and the ambitious development of the Innovation District for Leeds and the launch of our Innovation Pop-up. I am thrilled to say that the progress for Building the Leeds Way continues apace, despite all the challenges that COVID-19 has presented. We unveiled the designs for the new hospitals in August, and they are on track for completion in 2026, with the new pathology building due for completion even sooner in 2023. The standout moment for Building the Leeds Way during 2021 include starting demolition of the old buildings of the Leeds General Infirmary site, including the old nurses' home. In October, we held a Hospital of the Future's Market Day, even to attract interest from designers. In January, demolishment of old buildings on the new pathology site began, and the site is now wrapped with pictures, hoardings of our valued staff. During March and April, we held briefings with staff, stakeholders, and I led a special briefing with MPs. Since then, we have continued engagement, including 2 virtual visits to the Leeds Children's Hospital by our Royal Patron, Her Royal Highness, the Countess of Wessex. It really is a hugely exciting time for the Trust and for the people of Leeds and across the region. Thank you for supporting us throughout the time we have been working towards this goal. I am certain that I am not alone in my excitement to see us take the next steps of this ambitious programme. Whilst the coming months remain uncertain due to the evolving situation with COVID-19 variants, I am confident that the incredible teamwork we see demonstrated every day at the Trust will ensure that we continue to make excellent progress against our objectives, restore service levels affected by the pandemic, and deliver our vision to be the best for integrated and specialist care. I would like to finish by thanking our stakeholders for the belief in us over these challenging times and their support in helping us continue to make progress. Equally, I would like to thank everyone for their tremendous support during this period of unprecedented pressure. Thank you to those who clapped, to those who wrote the letters of gratitude, to our marvellous colleagues on the front line of healthcare, to those who sent handmade gifts, to so many businesses who sent contributions to staff welfare. I personally signed 1,500 letters of thanks, so if I did miss anyone, I apologise, but thank you. Thank you in particular to our own Leeds Hospital charity, but also to the many other charities and volunteers who supported us. You will never know how much every individual act of kindness meant to those providing care in our hospitals. I would now like to hand over to our Chief Executive, Julian Hartley, to share some of our highlights from the past year.